Welcome to In Good Company, Eldercare in Your Backyard, the podcast that brings local perspective on aging, caregiving, and healthcare right to your ears. I'm John Ray.
And I'm Spencer Ernst. Every week we talk with the people on the front lines, all making eldercare accessible to you. So John, In Good Company, Eldercare in Your Backyard. What's it all about?
We have been advocates for patients for the last 25 plus years. And in that time frame, I've realized that there are so many issues affecting growing old in the United States. And there's so much things that are changing constantly. And people need a place to go to get information about specifically related to older adults. When I say I've been advocating, I've been trying to tell them bits and pieces, but never the whole story. It's hard to explain the whole story without breaking it down into pieces and simplifying things. So I thought, what would I want to know as I'm getting older? I'm 54 years old. And I've got to start thinking about all of these things and making sure that I'm applying these things into my own life. And we want to talk to as many experts in our area that affects primarily Southwest Missouri, but a lot of these topics extend nationwide. But what is being older in America today, and what are the pitfalls and the things that knowledge is power, and so we want to bring that to people as much as we possibly can. So it'll be related to healthcare, and just navigating healthcare, different levels of care, being able to advocate for themselves and family members advocate for them, and clinicians have more information to advocate for their patients. We want to dive into insurance and how complicated that is, and what people need to know, and what they hear in mass media or commercials versus the reality. And we want to bring people who are providers and insurance experts and that sort of thing to the table so we can kind of dig into that a little bit more and really help people make a good decision as a consumer. We want to dig into wellness and some of the changes that are happening in healthcare, some of the goods and the bads, to say, some people are starting to go alternate directions. They not that they're going outside the medical community, they're going to clinicians, physicians that have a little bit different focus. And what does that mean for them so that they can make the right choice? Not everyone fits into the pill that they offer or the surgery that they offer. And, what are those alternatives? And we want to dive into all of those things. We want to focus a lot on protecting people's assets. People have a nest egg. They've worked their entire life. They're going into retirement. They're on fixed incomes. But, healthcare is the leading cause of bankruptcy for people 65 and older in the United States. More people go onto Medicaid because of a health-related issue when they're over 65. And so we have to dig into how our system works here in the United States and try to help people navigate that so that they at least understand if there are things that they can do. And there are things that they can do to help protect those assets, if for themselves, because they want to, live off of those assets for decades, or if they're wanting to pass some of those assets on. All of these things are critical for people. So there's a whole host of things that we're going to do. We're going to get some of the best experts in our area and even nationally that we're going to bring to the table to be able to weed through some of this complication. And we're hoping that at least we're going to get to some folks that really need to hear this. And sometimes as a child of my parents have passed away now, but before they passed away, there were times during that process where I just couldn't tell them anything. They just would, I just wasn't the expert, and I needed a place to be able to go, well, here's an expert, here's some resources. Listen, if you don't listen to me, listen to this guy, that sort of thing. So at least people have a place to start some of these difficult conversations sometimes when somebody's getting, the early stages of dementia, or, they're getting closer to a palliative or hospice choice. Maybe there's a higher level of care. All of those things are very difficult to navigate, and navigating them by yourself is just, I don't advise it. So you need a place that you can go to get good information, and we hope to be that for people here in Southwest Missouri.
That's fantastic. So this is truly a one-stop shop for listeners and viewers to basically get all their health questions answered in terms of elder care and beyond. So I guess the big question is, what's in it for me, especially for people that may not be at that age? How could this podcast help them navigate for their parents or their loved ones?
Yeah, that's a tricky thing, because oftentimes what we run into more than anything is people are put in a situation where they have to make decisions very quickly. And I will say that sometimes those decisions aren't the greatest because they're forced to make those decisions so quickly. And with a little bit of planning, with a little bit of knowledge, they could have mitigated some of the damage, so to speak. So you're right. There's some people that they're not to that stage, but they probably know somebody that is. And also they may want to, somebody who's, independent and doing great and doesn't have any issues. They may actually just be curious about some of this, that they want to understand how skilled nursing works. They want to understand what independent living and assisted living is. They want to understand how the hospital system works, and, when they're admitted or when they're under observation and why, and, all just trying to get through some of that, or, they're trying to make a decision on what insurance to take. And, we'll have experts on here that are going to be people that they can look to at least give them some information. It may not be the be all end all to make that decision, but at least it will be some information they can rely on to say, I think I can make a better decision now than I could before I listened to the podcast.
Speaking of information, it sounds like it's also a topical podcast. You're going to cover what's in the headlines, what's going on in DC and abroad, and so kind of breaking down what that means. So what type of stories would you cover outside of just the experts here locally?
Yeah, we're going to try to bring it back to the practical side of things. So, I'm a businessman too. And so the follow the money, so to speak, is usually the first place I go. And understanding that healthcare is a business, insurance is a business, all these other side services, the different levels of care, they're all businesses. They have a business model. And you kind of pulling that curtain back to help you understand what's going on behind the scenes really does help you understand why things are the way they are. Oftentimes people say healthcare is broken, or insurance is broken, or our system is broken, or whatever. It is designed exactly the way it was meant to be. And it unfortunately is a for-profit for the most part. And because of that, there is a component of buyer beware. So giving people information to be good consumers in the healthcare world, in anything that is a service to older folks, definitely needs someone to dive into that and go, what of this is good, what of it is maybe not as good, and what to look out for, because it can be very complicated, and caregivers are quite overwhelmed. And so oftentimes you have to take it in pieces. When something major happens to a loved one, you're barraged with all this information all at the same time, and they're asking you to make all these decisions that, quite frankly, you really didn't want to have to make. By listening to a podcast like this, it will start feeding you that information slowly over time, maybe long before you actually need it. And then that way, none of this is like a massive surprise. The other piece of that, what you just mentioned, was current events, the news stories that are coming out, because things change so quickly. So we have to keep people up to date, because even, in the Medicare Advantage world, Medicare Advantage policies change every year. I don't know that a lot of people know that. They think Medicare Advantage, that policy is going to be the same, forever. And it isn't. It changes every year, and understanding the pitfalls that can happen, because again, it's twofold. It's about protecting people's assets, but it's also about protecting people's well-being, making sure they get the care timely when they need it, and to the same amount of care as people on other insurances. So really defining what good care is in different levels of care, making sure that they understand, that different levels of care have baseline requirements, but then what does good care really mean? And we're going to bring a lot of guests on that are going to help define that for us.
That's awesome. It can be a scary world out there in terms of healthcare. I know some people get confused with things. And as you mentioned, things change year after year. So how can this podcast put people at ease with this new information?
I do think getting comfortable with some of the terminology and understanding kind of what motivates a business to do the things that they do. I don't know if it puts them at ease as much as it might concern some of them, but at the same time, knowledge is power, and the better understanding they have of how the industry works and the different components of it to be able to protect them, I think it does layer in comfort. So if they know they've done everything to, from a legal standpoint to protect assets and having the right insurance, and they understand what they should expect if they go into the hospital or go into a skilled nursing, or what the different levels of care. When they understand all of those things, it does bring some comfort to some people, because then it empowers them so that they're not walking in completely blind of what's going on. They at least have some baseline knowledge to be able to go, I can advocate for myself, or I can advocate for my family, or I can advocate for my patient, and give them at least some really good resources or information to say, this is good, this is not so good.
Absolutely. In the name, in good company, which is, I think, a fantastic way to talk about these type of topics. What brought you to that name, and what does it mean for you?
It kind of is one of those names that you could derive several different meanings from. And healthcare, including every aspect, the legal part of it, the healthcare part of it, the insurance part of it, is chocked full of people who really care about the elderly and the older, vulnerable adults, older people. They have a passion for it. They love it. And so we have to stop looking at these different industries as separate. We have to really say, if you work in elder care, then you're part of this overall team, and you're part of being in good company with us. And we want to really focus in on people who really do love the elderly, want to protect them in every way possible. And there are a lot of vulnerable adults that slip through the cracks in our society right now. They don't have any advocates, they don't have family, and they don't have a safety net in some ways, and so, making sure that everyone understands how to protect themselves to not become one of those people that slip through the cracks, plugging into support groups. There's advocacy groups out there that they can join, that sort of thing, to try to help mitigate and make sure that there's some support there when they need it.
That's awesome. The biggest takeaway from the podcast, what are people going to bring home and learn from this as a whole? What's something that's really special about it for you to do something like this for the community?
Well, geriatrics has been my calling for a very, very long time. I was always very close to my grandmothers, and they were very special to me. And as they grew older, I saw things change for them that were both good and bad, and what drove me to this was really because I wanted to make sure that that people understood the different topics that we're going to cover, because had I known them at the time, I probably could have helped my grandmothers more as they grew older. And the same with my parents. I've been doing this a long time, and even then there were things I didn't understand or know, and I didn't have a plan. And that was probably the most important thing that somebody could take away from this, is they can develop a plan for their loved one, or if something happened to them, they have a plan that they know they've covered most of their bases to help them have a better outcome. Because ultimately, when you look at two different people that have, let's say, two different insurances or whatever, they can have two very different experiences in the healthcare system, depending on whether they have the right insurance or they can advocate for themselves. And without that outcome can be drastically different and life-changing in some ways. And so the big takeaway is again, building that knowledge and having a plan.
That's amazing. In Good Company, Eldercare in Your Backyard debuts on September 3rd, 2025, wherever you get your podcasts. John, thank you so much.
Thank you.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Eldercare Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Eldercare Podcast.
Thanks for tuning in to In Good Company Eldercare in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.